All right.
And me too.
Test exhalation port. This is your exhalation port. So I'm going to say I want to test it. It tells you what to do. You just occlude this, press monitor, start test, and then let just ramp up. Yes, you do have to do this.
Should you wear gloves when you do that?
Yes. Okay. The test is over at passed. Once that's done, now you can go in to set up your machine. You can go over, oops, you got to hit monitoring for it to work. You can go into parameters. Once you hit parameters, you can see that screen change. See how that changed? I can't make setting changes from here. I can only do it from, if I hit parameters, then I can go in and set my IPAP to the order up here, 12 over 6. All right. Where's your mask? Is there one that's already open?
I didn't open
I'm
one.
stingy with these masks.
This one looks open.
Yes.
Is it open?
Actually no.
This one wasn't either. No one opened it.
What's in here? Now, what is it a small? I'll open a small. You guys can play with the small. Stop recording me.
You're under pressure. What?
It's going to be on YouTube.
You should put it on YouTube sometime.
Notice how this is coming like this? You'd have to take all this stuff off to get to the mask.
Would that be prior to all this?
That's small.
No, because
This
you
is
don't
a
want to
small.
get contaminated.
And then you'd have to take these out. Well, I'd be wearing gloves.
So would it be prior?
Well, what's the other thing you're going to do? You're going to test this out to make sure it fits your patient, right?
Yeah. Oh, so yeah, duh.
All right. So then you take this, connect this to this.
Okay. Alright.
Now I can actuate this. I can stick it on my face. And if I was going to do that, a small does not fit me. But here's all your attachment points. Right. See how I'm actuating it? This would be on your patient. I'm at 12 over 6. The rate on this particular machine is more like once the patient's gone apneic. It's not just giving breaths until the patient's gone apneic. All right. Now this is your whole thing. Now when you get over here to hit monitoring, this is just what your machine would look like plain. You get to this one over here when we've got the parameters up. You can see there's your leak, which is high, because I was holding this on my hand. There's the estimated tidal volume. Those are your big things.
So all you set is the IPAP and EPAP?
All you're setting on here is your IPAP and EPAP.
Okay.
And you can set a respiratory rate, but just remember what you're setting. You're not giving your patient that number of breaths.
Yeah.
It's just a backup. All right.
Make sure they are.
And then if you wanted to go from this is an ST, so spontaneous / timed. If you want to go from that to CPAP, you come over here. I think it's back here. Options. Wait, it's not.
Mode.
Where?
Modes?
Oh, there it is. I got to go back to here though. So I hit mode. I go to CPAP. Remember, you have to activate the new mode. That's the big thing. Now I'm getting a CPAP level right here, which I can change if I want to change it. If I want to go back where I was, hit mode, I can go to ST. Again, you have to activate the new mode or it won't switch. Okay? Does that make sense? This was like your quick and easy machine. Pretty easy?
Yeah.
So you have to hold it when you're...
No, because once you have this set up, like, all right, and here's the other thing that's nice with this machine. If I shut it off and I come back to it, go to put it back on the patient, it's already ready to go. Like, it'll still run through this. You don't have to go back through the whole pressure test. Once you've taken it out of the equipment room and set it up, you don't have to keep doing this pressure testing thing.
How did
So
you get to do your pressure test again?
from here, it asked me when I first turned it on. I may have to leave it off for a little bit longer, and it will go. It was actually in the beginning screen. It runs through, and there's a thing that says test exhalation.
Could you
point.
do
hit
check
that.
then? When we do our competencies,
No.
will we have to?
Yes,
Well, it will pressure check it,
you will have to pressure check.
but I'm not gonna. It will do it when I turn it on.
No,
I'm gonna have to
you're
press the button.
you're gonna do it like you're setting it up for a new order.
There's a button.
But see, all I did here was I turned it on and I went right in. Like if I leave this off, normally it'll come up and it'll tell you down here, press monitoring to start ventilation. The rest of it is all pretty easy because it's your alarms are here, your setup is, this is your alarm silence, this is your alarm setup stuff. So I'm going to turn it on. It's going to go through the self-test. That is not the pressure test. If I want to pressure test it, it'll finish that. There it is, test exhalation port. And then I say, okay, I occlude that with my gloved hand.
That will always come up when I press it on.
If that will be there, you have to tell it what you want to do, and then you do it. When it's done, then it tells you, oh, intermittent excessive flow. And probably the rationale for that is because we have this in here. I don't think there's anything else. That's probably the reason why. But once that's all set up, then it tells you right here, press monitoring to exit this. Once you press monitoring, like you can feel that. If you were to stick this on your patient, you'd be fine. They're going to get like that little bit, but once you hit monitoring, then it starts doing whatever you had it in before.
Oh, when you turn it on before you turn it off. Oh, okay.
Now it's right back where it was.
And why don't you have to set the rate again?
It's really just a backup. It's really like when your patient goes to apnea.
Okay.
If you want to change your alarm stuff, it's all right in here. Parameters, probably. What the heck is the alarms? No, that's what it is. Oh, that's the setup thing. So when you go through, here's your high and low. This is the delay thing. Just like on that one has a delay. So in other words, if you have it set at 0, if something goes wrong, it immediately alarms. But this is your high pressure, low pressure alarms. So if this comes off your patient, that's where this comes in.
Do you always keep that at 0?
That's the delay. You can put it like a little bit more. I would probably put it a little bit more because it would maybe not alarm. It's in seconds. You can give it a 5-second delay.
And what's the high P and low P?
High pressure, low pressure. So if the pressure gets really high in here for some reason, or really low, like it comes off the patient.
Okay.
Now it's going to have it, and see here it's disabled. So basically the patient could pull it off, and you would have no idea because it's never going to alarm.
What would make it randomly get really high?
When
Like
would
what?
it get really high?
Yeah.
If there was some sort of obstruction or occlusion, and maybe the patient's breathing back on it. I don't even know that I can make it do it, and I might not be able to because I've got this in here, which is a lot of extra volume, and the machine doesn't really know how to compensate for all that.
So you don't really have to touch that. You just leave it around ready for it.
It depends. Depends on, I would probably set it, leave it there, maybe 25. For these settings, it's all based on your settings.
10 minutes later. Waste all my memory.
Alright?
When you don't use a heater and you just hook it up, do you use that extra little piece?
No.
Right, because it's not.
This is for the heater only. And these guys set this one up, and I really need this one set up with the heater.
Wait, what's for the heater?
Are you setting one up? That'd be awesome.
This extra piece of tubing.
Is that one hard?
This is just your heated
No,
setup.
it's not really. It's not working.
This
Once
is
he
the
tells
only
you.
vision I have with the heater.
That stinks.
This one I need that set.
That you be safe before setting it. The way you take this up, setting up all pieces.
I know. But I take pictures.
Like